Molnupiravir, still seeing within the range you'd given $5 to $7 billion for the year, but narrowing it now to $5 to $6 billion. How are expectations of that drug kind of shaking out as you start to deliver it more around the globe?
Yeah, so as you look at it, we're actually in line with the original guidance we gave. When we gave the guidance of $5 to $7 billion, that was cumulative over what really ended up being a portion of it coming in the fourth quarter, which is about $950 million, and then the incremental 5 to 6 as you look at 22. So we're in line with what we expected it to be, and this is really based on the strength of what we're seeing with the number of strategic purchase agreements we have in place. We now have agreements with over 30 countries. We've delivered product now to over 25 countries. We're on track. If you look at by the end of 2021, we delivered 1.4 million courses in really just the last couple of weeks of December after we got emergency use authorization in the United States. And importantly, we're on track to meet our full commitment to the U.S. of 3.1 million courses here in the next few days, and are really on pace for about 4 million courses delivered globally as we speak. So all in all, it's off to a strong start. We're going to have to see how the pandemic evolves, what happens with Omicron. We've shown that Molnupiravir works against Omicron, which is important against that variant. And obviously, we'll have to see how this plays out and what is the initial uptake. But right now, we feel we're off to a good start. We just have to see how the year plays out.
And will you be tracking how Molnupiravir does in terms of the real-world outcomes data? You showed, of course, 30% reduction in risk of hospitalization and death, but 90% reduction in the risk of death in your trials. Will you be able to provide data showing what this can actually do when given in the real world?
Yeah, and I just want to emphasize the last point you just made, because I think this is so important. If you look today, despite the fact that we are starting to see, at least in the United States, the wave of Omicron is moving its path through, we still are facing over 2,000 deaths due to the COVID-19 a day. And the fact that that Molnupiravir does reduce the risk of death by 90%, we could have a meaningful impact in helping patients. So I think that's very important. But as you talk about real-world evidence, we are continuing to look at how the drug is performing. There's actually an important study going on in the UK that's being led not by us, but by the government in the UK, the panoramic study. That'll give important information, and then we are continuing to track what happens as we start to roll the drug out around the world. So over time, we do expect we will have more real-world data that should help to really inform how this drug is doing.